Hey YouTube, this is Tanya, and this is the start of my tummy tuck journey. Just a little history on me. In November of 2011, I had the vertical sleeve gastrectomy surgery. My highest weight ever was probably in 2003, I want to say. I was in the 290s. When I had my surgery in November 2011, I was 272.8. And right now, for the last year and a few months, I've been hovering in the mid 160s. So, I am going to have a tummy tuck, abdominoplasty with muscle repair and a little lipo. So I'm just starting the journey, and I had my pre-op appointment last week with my primary care physician to get cleared for surgery. And this morning I had a pre-op appointment with my plastic surgeon. So I was going to run through the things that we talked about, and at the end I will show my skin and what it looks like, so that you can kind of get an idea of what we're working with here. So some of the things that we talked about today were what my incision is going to look like, and some aftercare. My incision is actually going to be the the horizontal from hip to hip, but I'm also having a vertical, which is called either an inverted T, Fleur, anchor. My incision on the vertical one will go from my belly button down to the pubic area. It should not go above my belly button unless, there's some extra skin that she wants to remove, but she didn't think so. There will be lipo on the top part of my hips and on the lower part, like where the saddlebag area is, just a small amount to kind of smooth things out. And then in the little pockets, and you'll see at the end when I show my skin, the pockets of fat that are above my waistline. She's going to do a little lipo on that too. So I have some notes, just the things that we talked about. I talked about how wide and how high my incision would be, where the lipo would be. The compression garments, what she was saying was when I come out of surgery, I'm not going to have any kind of gauze or any kind of material type covering on the incision. I'm going to have, she said what it's going to look like is like plastic wrap. It'll be the incision with the stitches and then plastic wrap on it. And she said it just kind of keeps it cleaner and pulled in, and that will stay on me. She said with that plastic covering the incision, I'll actually be able to shower the day after surgery. And so that should make you feel a bit better. I know some people have to wait several days before they can shower and they feel really gross. So I'm happy about that. Also, I'm going to have a pain pump, which the pain pump actually it's like little catheter lines that go inside the fold of where they bring in the muscles. And it just is constantly delivering a numbing medicine to keep that whole area numb so you don't feel that achy pain. And she said that it's well worth it, that it helps you get past that first few days of a hump of the serious pain. I think she said that the pain pump the medicine runs out within 3 days. And then after those 3 days, I can actually remove, when it's a ball that has all the medicine in it, and when the ball is completely collapsed, I can actually remove that pain pump myself. And she said it's a thin, thin, thin wire. It's no big deal to remove it yourself. Along with that, I'll also have the 2 drains, and that will stay in. I have my surgery on November 13th, 2013, and that's a Wednesday. And on that Tuesday following is when I'll probably go back and have the drains removed, unless, of course, they're not finished draining and they're still collecting lots of fluid. But she said usually by that time, people aren't draining a lot of fluid. So we talked about seromas. A seroma is when, after you have your the drain tubes removed, you can have like little pockets of fluid that develop. She said it does happen sometimes. It doesn't happen every time, so you don't really know, if you're going to have it or not. But she said if I do have it, that she'll just drain it with a needle until it stops filling up with fluid. And it's just like a pocket of fluid that develops between the muscle and the skin. I asked about healing issues for where the vertical incision meets the horizontal incision, and she said that can be an issue. That what she sees is when Where the two incisions meet, you'll have like a little like diamond piece of skin that'll get dark and will take a little bit longer to heal than the rest of the incision. But she said within 2 or 3 weeks, that dark skin will kind of slough off, and then it'll be like a mucousy kind of skin, I guess, underneath, and that'll kind of slough off, and then it'll wind up healing nicely. I asked her about dog ears, the possibility of having dog ears on the hips, and she said that that is not a problem for her. She has not had problems with people having dog ears because of the way she closes you up. She said, and I hope I'm explaining this correctly, that the skin that you pull down, the length of the horizontal cut needs to be like a similar size to the bottom of the incision. And what happens is sometimes a lot of times, the skin that's getting pulled down is a bit wider than the bottom incision, the bottom line. And so it has to be gathered a little bit. And she said some surgeons start stitching up from the middle and work their way to the outside. So then you have like a puckering of skin on the outside. And she said that what she does is she works from the hip in and then from the middle out. And then she kind of does the gathering kind of in the middle of those two sides. So it's kind of on the edges. Like in here, instead of it's not here and it's not here. The gathering is kind of here. And that over a couple, several months of healing, it all kind of evens out. But she said with me doing the vertical incision, she'll have less skin that has to actually be gathered together. So she doesn't see where dog ears would ever really be an issue for me. What else? Let's see. I asked her to take pictures of the skin that is removed in the operating room, and she said just a reminder, and she would do that. She said they do weigh the skin, so she'll let me know how many pounds were removed. Let's see. She said for like your private area, not to shave it because there's a possibility of having like ingrown hairs. So she said just to trim the area, so that way the hairs are kind of already out and you don't have any issues with like ingrown hairs during the healing process of the incision. And I asked how long until I can have sex after surgery, and she said 6 to 8 weeks. And what she said was interesting. I hadn't thought of it this way before, but that it isn't so much of like a physical thing. It has to do with bacteria, and that your body can fight its own bacteria. But if you introduce somebody else's bacteria into that incision area, that's when infection can happen. So she said she really doesn't want me even touching my own incision with my bare hands. That the only time I should ever touch if I do touch my incision to clean it, I should have dial soap on my hands before I touch my incision. That way I'm never introducing bacteria from my hands from touching other things without the antibacterial soap on it. So that's it. So I'll talk about the skin. So I'll show you kind of what I'm working with here. One thing she did, like when she was pulling on the skin to see what she was going to remove, she said, she's like, God, you're so thin. And coming from a place where I was morbidly obese, or maybe even super morbidly obese, to hear that you're so thin is kind of a strange thing to hear. But okay. So she did markings on me today when I saw her, just so I can get an idea of what she's going to do. So this is my apron stomach, and the lines that she has drawn here are kind of like the loose lines of what will be removed. So all this, all the way out, down. This will be where my incision ends, and this will be where it ends over here. And she's actually going to remove down about, I guess that's like maybe 3/4 of an inch into the pubic area. And she kind of showed like if you lift all this up that it actually helps the thigh area, the shrinkles that I have in the thigh area. The top of this, like top of the fleur de lis, this will be the top of my belly button down here. So all of this will come down and then it'll close up around the belly button. She said my belly button's going to be really nice because she said I have a good belly button. And I told her, it's always been really deep. And she said it'll still be deep. It just won't be as deep because I won't have the thickness of the stomach hanging around it anymore. So the incision, the vertical incision will go from here to here. But all of this will be removed. She said that she's going to do some liposuction on my hips here. in here. She said, I don't have a lot of fat to remove, but just to kind of smooth things out. And then she said that I kind of have, my hip on this side is a little bit, I guess like saddlebag is, I don't really have anything here, but I have a little something here. So she said she may do some lipo there just to kind of even it out. She said she doesn't want to create any ripples in the skin, and lipo can do that sometimes, but she's just going to do enough to try and smooth it out a bit. And she said that she's going to do lipo in this area here just to kind of take out the little pockets of fat that I do have in here, so that way when it gets pulled down, it's all smooth and evened out. Okay, so that's the skin that I'm working with. I really, just to see the back, like I don't have a lot of loose skin in the back, and the lipo will come up in here. You can see that she has the lines drawn. And with the pulling, with the vertical cut, it's going to pull it even tighter. So anything I do have, I think it's going to be totally fine. So that's kind of what I'm working with, and I'll look forward to all of this loose skin. I did have 2 pregnancies. My first child was 7 pounds, 2 ounces, and my second child was 8 pounds, 6 ounces. I was already heavy before that, and got stretched out even more, and I'm really looking forward to having those muscles pulled together and having a nice flat tummy. So my surgery is 3 weeks from Wednesday. Today's Monday, and I plan on documenting as much as I possibly can, as much as I feel up to it. She does want me to spend the night in the hospital the first night, so that the nurses can take care of me. And then I'll go home on that Thursday, and then I'll go back to her on that Tuesday for a drain removal and for her to check me. So I guess I will be back maybe the night before surgery, or certainly the day of surgery. All right. Thanks, guys. If you have any questions, please feel free to leave comments below, or send me a personal message, and I'll be happy to respond. Bye.